Well, the bill came to me by a lady that in Hickson who called me or emailed me, was concerned that her kids were on the way to school at Hickson Elementary School. I live in the neighborhood right next to it. And at 7 o'clock in the morning, somebody pulls up in a car and shoots a guy right in front of these kids while they're walking to school. And as she got to looking and investigating, she found that this was a sober living home, and she called my office and asked me what could be done about it. She went to City Hall, and I watched her at the city of Chattanooga, and they basically said there's nothing we can do, and they weren't wrong. So that's why we presented this bill that we're presenting in committee next week to address that issue. Children don't need to see adults shooting each other at 7 o'clock in the morning that are living in houses where people don't have any supervision, that are in recovery homes. There needs to be some type of guardrails, and there's none.
This is going to allow local governments to decide, how far away the sober living homes need to be from schools, right, and daycares and preschools. Does it do anything relative to like family neighborhoods, residential homes?
Well, no, you have to be really careful with the federal government's American with Disabilities Act. That's going to be the challenge in that, because you cannot discriminate against those that have a disability. And even though it may be alcohol or drugs or something like that, it's, that's considered to be a disability, and that they're protected. So you have some challenges there when it comes to that. You can't say, I'm sorry, we're not going to have somebody with a disability live down the street from me, whatever the disability is, and if it happens to be drugs or whatever. So I get that. So that's a little bit of the challenge. And but what this bill is going to do is it's going to allow cities to be able to have some type of zoning with regard to this, and I think that's going to be good. Now it's going to be permissive. It'll really be up to cities if they want to adopt some types of regulations that don't violate the federal law there.
And is the Americans with Disability Act, is that what's kind of prevented local governments up until this point from doing this, or what has prevented them from doing this up until now?
Well, I think the federal Congress has the American Disabilities Act, and they have some guardrails that protect the rights of people that have disabilities, of which some are in these recovery homes. And so, one of the things that this bill says is that for you to live in one of these homes, that you either need to be referred by a licensed professional and or the courts. So this idea of just self-identifying as an alcoholic or a drug addict, and I'm going to go live in this Airbnb that's down the road, and it's being used that way, and no one's referred me, no one's told me I need to be there, no one's helped me get there, there's no services, there's no AA, there's no treatment, that to me I think is an abuse of the system. And someone could for example, get mad at their husband or their wife or whatever and say, well, I'm out of here and I'm going to go to this house and I'm going to self-identify because I used to be an alcoholic 5 years ago and now I'm sober. And you end up with 8 people living in a home that's built for 4, and the septic tank, and they may not have the right fire extinguishers, the septic system may not be right for that. That's where I think an abuse can come in, and where cities ought to be able to have some type of latitude to not discriminate against people with disabilities, but to have some guardrails that can help protect the integrity of the neighborhood.
All right, what else you got for me?
Okay, so we passed a bill last week. I was really proud to pass that helps with pregnant women to allow for more testing when it comes to congenital syphilis. And let me tell you how I got this bill. This bill came to me is I had a lady who was working on her PhD at UTC, and in her doctoral thesis, she came across research that congenital syphilis has risen by 548% in the last couple of years in the state of Tennessee. That's crazy. So you have these women that are pregnant who are contracting syphilis, and they're passing that on to their babies when the baby is born. But if they take a penicillin shot, it will not only heal the woman, the mother, but it'll heal their child. And they're not born with all the neurological problems that a baby would have with syphilis and would die early as a child. So this was a bill that basically gave direction to those in the medical field to when to test pregnant women in their 28 to 32nd week of their pregnancy to see if they have contracted. When they're already doing and the test is nothing but just drawing the blood, which they're doing anyway, and when they take that vial of blood to test it for that. It's not an invasive test. You know, some critics were saying that, well, you know, this is the government telling people that they have to do this, but not really. Because if you're in a hospital and you don't want to take an aspirin, you don't have to. You know, we're free citizens in a free country. And if people don't want to have their babies in the hospital, they don't have to. People can still have them in a log cabin, or they can have them at home with a midwife, whatever they want to. But when you have a health crisis where 548% increase rise in congenital syphilis, and it can be cured, and this is about protecting unborn children. This is about making sure that unborn children have the ability to have a normal, healthy life in spite of some perhaps poor choices that their parents have made. And so, you know, it had a little pushback from some people. I never really understood why anyone would be pro-life and care about the unborn baby and not be helping in that space. So, you know, but we passed it. I think we had 12 people vote against it, something like that, and which was just interesting. But we had, I think, 79 people vote for it. But I think it's going to be something that's going to help. I mean, wouldn't you agree that 548% increase in that is off the charts?
It's definitely high.
Yeah, I mean, that's a health risk issue. So we tried to address that issue.
What is the reasoning for that being so high? Do you know?
Well, people are just, they're not doing things the way the good Lord intended them. How about that? Is that a good way to say that?
I think that's a good way to say it.
So, you know, when people have risky behaviors, then you're going to have unfortunate outcomes. And that's what's happened here. And so bringing awareness to that is huge, you know, but bringing a cure is even more important. And so you can't get cured if you don't know you have a problem. And so this bill was about helping to test so that, I mean, who would not want to know that they had something going wrong with them and the life inside them? Who would not want to know that? Well, I'm glad we moved forward on this. And what's really cool about this bill to me is the fact of how it came to me. It came to me from a constituent. I didn't know who she was. She just called me up and said, "Hey, you're my representative. I want to come see you. I want to talk to you about something." I didn't know her from Adam's house cat, but it was real. And that's the way our government should work. You shouldn't have to know someone to have a conversation with them when they represent you in government to say, "Hey, I've got an idea, and would you consider doing this and championing it?" And I thought, you know, this is really, really important.